to the drinking water. We're on your side tonight with potential changes to your H2O. This month, Utah became the first state to ban fluoride from its public drinking water. Some lawmakers in South Carolina, well, they want to do the same. The naturally occurring mineral has been artificially introduced to water systems for more than 60 years because of its positive effects on our teeth. But it's now facing increased scrutiny all across the country. Nick Reagan shows us why and how much fluoride gets into our water and why the calls to remove it are getting louder.
There are a lot of additives that go into the water treatment process, and the important thing to know is most of them are food-grade chemical additives. You have alum that you'll find in your grocery store in the spice aisle. We add orthophosphate, which is another food-grade chemical, and that's what coats the inside of lead and copper pipes and keeps you safe if you have lead in your plumbing.
Also added, fluorosilicic acid.
We have fluorosilicic acid delivered to our water treatment plant a few times a month to keep up with our demand. And it goes through a series of pipes and a series of holding containers because we want to have very fine control because our dosage amounts are very, very exact.
The recommendation from federal and local health officials is that fluoride be added to the water at 0.7 parts per million. To put that into perspective, if you've got 4 5-gallon buckets of water, you would need to add 1 drop to get that concentration. But even this one small drop is being closely looked at.
I'm working with Lee Zeldin to reassess the fluoride rules based upon the August release by the National Toxicity Program of new science that shows a direct inverse correlation between exposure to fluoride and IQ loss, particularly in children.
A national conversation spearheaded by Health and Human Services Secretary Robert F. Kennedy Jr. about removing chemicals from our food and water supplies has given voice to people around the country demanding fluoride be removed from drinking water.
A federal judge has ruled that the risk that this could be the cause is too high, and it should be further studied. In our situation, we think, yeah, let's just take it out and encourage people to brush their teeth more.
That conversation is now being considered by lawmakers here at home with a bill in the House to ban water providers from adding the naturally occurring mineral.
The question is how much is too much regarding brain health and brain development for kids. So I think at this point in United States history, or in our current circumstances, it's not worth the risk.
Community water fluoridation has been hailed by the CDC as one of the 10 greatest public health achievements in the 20th century, being credited with reducing tooth decay by 25%.
Over a period of the last 50 years, I've seen actually a dramatic decrease in the amount of tooth decay that we actually see.
Dentist Dr. Bill Sasser leads a nonprofit dental clinic catering to those who otherwise would not be able to afford dental care. He says he can tell which communities have fluoride in their water just by looking at their teeth.
Particularly in Latin America, we see it's a sad story of just endless numbers of patients that come to us with teeth that are really bad, many of which can't be fixed, particularly even with young people.
Recently, studies like this one published in the JAMA Medical Journal or the August report from the National Toxicology Program have loosely linked fluoride to lower IQs in children. There are, however, 2 major problems with these studies, according to the American Dental Association. The studies are not actually experiments and are just analyses of data taken from other studies around the world, most from China and India, none from the United States. The strongest results in that August study makes a moderately confident conclusion that there could be a link to lower IQ scores and fluoride when the concentration is more than double the recommended level. Who stands to lose the most if fluoride is taken out of public water?
The folks that are going to suffer the most are those individuals who really are already hurting from a standpoint of public health and, economically and other things.
That was Nick Reagan reporting. Now, South Carolina's bill to remove fluoride from water is still stuck in committee. Well, coming up